What is EMDR therapy? I get asked this all the time, so let's make a video that explains it all the way through. I'm going to give you all the information I think that you could possibly need to understand EMDR. EMDR stands for eye movement desensitization and reprocessing. Obviously that's a mouthful, so that's why we call it EMDR. EMDR is a protocol or a treatment method for managing trauma. EMDR was developed by Francine Shapiro back in the 1980s, when she realized, she was a counselor, and she realized that when she went out walking with her clients, they managed their trauma better than if they were just sitting in her office. And through a bunch of fancy research, they realized it's because her clients were taking one footstep, then the next, then right, then left. A process that we came to know as bilateral stimulation. Bilateral stimulation is what I just described, alternately stimulating the left side of the body, then the right, then the left, then the right. Why do we care about this? When we do bilateral stimulation, basically what it does is it distracts our prefrontal cortex, which is the thinking part of our brain. Why is this important? To get this, let me explain a little bit about how the brain functions. This is going to sound a little wacky because most people just don't totally believe it. But the brain, the deep levels of our brain, know exactly how to heal trauma. Healing trauma is a natural process that our brain knows how to do. But our prefrontal cortex, or our thinking brain, actually can get in the way of that. The way that we think and the way that we stop ourselves or make ourselves do things after a traumatic event actually can stop our brain from doing exactly what it knows how to do in order to heal our trauma. What this can do over time is that our traumatic memories almost become frozen in our brain. So the traumatic memory happened, and instead of it being adaptable and we can go and we can think about it and we can look at it and question it, it becomes stuck. And no matter what we do, it's like we bounce off and we just can't get in there anymore. And so what EMDR does, by distracting the part of our brain that stops us from doing exactly what we know how to do, is it kind of loosens the memory so that new information can start going in there. Let me give you an example. Let's say when you're growing up, you grew up in a really abusive household. And so through this growing up, you learned, I'm a bad kid, I'm bad. And this kind of became a locked in memory. Maybe there's a heck of a lot of memories that led you to believing I'm bad. Now as an adult, you might have a different perspective. You might realize, actually, I'm a pretty good person. You might have that belief. But no matter what you do, it doesn't really seem to change that belief that I'm bad. Just can't get in there. So what we do with EMDR is we distract your prefrontal cortex so that this loosens a little bit and new information can start to go in there. So when Francine Shapiro first started EMDR, the way that she did it was with walking, so the left foot, right foot, left foot, right foot. But we realized there's a lot easier ways to do it in our office without having to go out walking where it's maybe not as confidential, we can't talk, or people could overhear us. And so one of the most common ways that we do EMDR is through eye movements. Remember, EMDR stands for eye movement desensitization and reprocessing. So what that would mean is that I would put my hand up like this and you would look at my fingers, and without moving your head, I would start moving my fingers like this in a whole bunch of different ways, kind of up and down, over like this, down, up, over, and you would just follow them. And what we're doing through that with the eye movements is your eyes are creating that bilateral stimulation of left, right, left, right. Another way that we've discovered that we can do this is with knee tapping. So I, as the counselor, would move closer to you so that I can physically touch you, and I would tap your knees, left, right, left, right, left, right, so on and so forth. They've also developed a couple of different instruments or tools that we can use. One is called a light bar. So it's a light that's kind of thin and long like this, and the light moves across. So just like the finger, you would just follow the light that's moving across the light bar. Another option is what we call tappers. These are two little pads that you would just hold in your hand, and they kind of buzz, left, right, left, right, left, right. So there's some cool kind of technology that's helping support EMDR, but it's all at the same level, just stimulating the left side of your brain, right side, back and forth to distract your prefrontal cortex. So now you know a little bit of the theory behind EMDR, but what does it actually look like in a session? There's eight phases to EMDR. Now, phase 1 and 2 can be a little bit, they're interchanged sometimes. What we often talk about as phase number 1 is case conceptualization. So basically what this means is that we need to understand, well, what are we processing? For some folks, it might be very obvious. Let's say you've been in a car crash. It might be very clear the EMDR that we're doing is the car crash. But let's say you had a traumatic childhood. So from the time you were born till the time you were 18, there was lots of moments of trauma. If that happened, we need to figure out which moments are we going to process. Don't worry, we don't have to process all of them. We need to find the main ones that we're going to process. So phase 1 is about case conceptualization, figuring out what are we going to process together. Now, phase 2, which some clinicians, rightfully so, will trade with phase 1, is safety building. Basically, if you can't talk about your trauma, how are we supposed to build a case conceptualization? How are we supposed to know what to do if you can't talk about your trauma? So some clinicians will move phase 1 first, and they'll help you build safety. So this one is pretty common to any type of therapy. You do it in any type of therapy, not just EMDR. This is learning how to breathe. This is learning how to create a safe space that you can go to in your mind. This is all about learning to regulate your body so that you can move into talk about the traumatic events without being distressed. When we do EMDR, we are literally asking you to remember the traumatic event. So we have to be able to know that you feel safe enough to do that. So we're going to keep you in phase 2, safety building, for as long as it takes till you're ready to talk about your traumas without becoming so dysregulated and so activated. I'll mention that for phase 2, a lot of clinicians don't do EMDR phase 2. What I mean by that is that EMDR has some particular tools and skills that they suggest. But a lot of clinicians come from different backgrounds, from DBT, from CBT, from emotions focus, whatever it might be. And what they'll do is they'll do safety building from that stage, and then they'll do EMDR after. This is absolutely recommended, and it works really well. If a clinician knows a lot of skills that they can teach you from a different one, that's great. Use those and pull them over into EMDR rather than forcing you to stay within the EMDR protocol. Phases 3 through 7 are what most people think about as EMDR. This is the phases in which we are going to ask you to bring up the traumatic memory into your mind, and then we're going to provide about 30 seconds to a minute of EMDR, so of bilateral stimulations, moving my finger, tapping, the tappers in your hands. We're going to ask you to think about it, and we're going to do that for a moment. Then we're going to stop. We're going to ask you what came up, or what did you notice? You're going to tell us kind of what happened during that time, just the end bit, and then we're either going to keep going with that, or we're going to redirect you. Because here's the thing. Let's say that you had an abusive childhood and we're processing one memory. It's very possible that during this stage, during this processing, you end up connecting back to a different memory. That might be helpful depending what the different memory is, or it might not be helpful depending on how we're doing this EMDR together. So when we pause and I ask you what came up, if we determine that it's helpful to kind of connect to that other memory, we'll keep going with it, or we're going to redirect and come back to it. We're going to do another set where you're thinking about whatever we just chose, whether it's the new memory or the old one. We're going to think about that for a moment while we're doing the tapping or the bilateral stimulations, and then we pause again. And we do this for however long your EMDR session is. We're going to move into the memories with the bilateral stim. We're going to stop for a moment, check in, redirect if needed, and then start again. We do that over and over again. During that process, what we are doing is we are desensitizing the old memory, so making it less sensitive, less triggering, and we are installing or building up a new belief. So, do you remember my example from earlier where I said maybe as a kid you think I'm bad, but now as an adult you're like, no, I'm good. I make mistakes and I'm good regardless. What we're going to do in the EMDR is bring down the belief I'm bad, and then we bring up the belief that I'm good regardless. The other way to think of that is that we're loosening this belief of I'm bad so that the knowledge that I'm good regardless can kind of seep into it and drop this one down while increasing the other. These phases of EMDR can be really overwhelming. They can be very tiring. What I often like to tell my clients is that even though you were just sitting in my couch for this last hour, your body has done so much work. It takes so much energy to be able to shift our thinking at this deep neurological level. So I tell people when they leave my office to pretend that they had just gone on a really big hike for an hour rather than just thinking that they were sitting in an office chair, and to treat your body like you just went on a really big hike, because it can be so tiring. Once we're at a stage where we've really decreased the one belief that we held, like I'm bad, and we brought up the next, what we're going to do as part of our EMDR is phase 6, which is the body scan. We're going to scan through the body to see if your body is telling any stories about the trauma. What we know is that the body keeps the score. That's a Bessel van der Kolk quote, where he talks about our body holds on to the memories of our trauma. And we might have shifted our beliefs in our mind, but our body might still have something to say about it. So for example, maybe there's leg pain that comes up every time you think about the trauma because your leg might have wanted to do something or did something in the trauma or traumatic moment that caused it pain. So our job next in phase 6 is to locate anything in your body that is related to the trauma, and then we do the same thing. We do the bilateral stimulation, so the tapping of the eye movements, we do the bilateral stim around that sensation, and we do that over and over again until the sensation has gone away. Phase 7 of EMDR is about closure. So basically, before you leave the office, let's stabilize you. Let's make sure that you're feeling okay. Let's debrief what just happened. Let's talk about it so you can logically understand and share your experiences with your counselor a little bit. Basically, this one is, we're not going to let you leave our office if you're a complete mess. We're going to help you feel safe and calm so that leaving the office is something that you can do and you can kind of go on with your day. Then phase 8, our last one, is reevaluation. So we don't do this every time that we do EMDR. We usually do it after a few times of EMDR, where we're checking in. Did that work? Are things getting better? And are there things that we missed when we made our plan at the beginning that we now need to include? For example, for someone who's experienced a lot of trauma, it might be that we thought we had the right memories, but as we've done the EMDR, new traumatic memories are coming forward that we want to add into our plan. And so reevaluation is all about, are we on the right track or do we need to shift anything? Phase 8, or the reevaluation stage, is also about looking at what we call the 3 prongs, which is the past, present, and the future. Obviously, when we're doing EMDR, we're looking at the past and helping kind of manage the past. But we also want to make sure that it's managing anything that you're feeling in the present and then looking towards the future. So for example, if you come across that person again or a trigger again, what are we going to do? How are we going to make sure that you feel safe and okay if that were to happen? So we're going to look to the future to figure out, is there anything that we need to process that hasn't happened yet? We call that future templating. But basically, if this were to happen, let's do EMDR around that to help you feel like you can handle any tough situation that comes up. So who is EMDR for? If you have memories in your past that when you think of, you feel them in your body, it's like a gut punch or you just kind of shudder and curl in, any memory that brings up a physical response in your body, EMDR is great for, whether you've been formally diagnosed with a trauma, PTSD, or not. If your body has a strong response, that's a good indicator that EMDR could be a really good fit for you. The other sign that EMDR might be a really good fit for you is if you have a belief about yourself that you don't want to believe, but it feels so true and like you could never let go of. I'm a bad person, I'm not good enough, I'm not worthy, I'm never safe. Beliefs like that you just hold to be true and you wish you didn't, but they feel so true. All of those are really great signs that EMDR could be really helpful for you. EMDR is not generally recommended for someone who is still in an actively unsafe situation. There are some exceptions to this, but for the most part, because in EMDR, we are activating you. We are going back into the traumatic moments and bringing them up so that we can manage them. If you already have a lot of unsafety outside and then we start doing that, it can just be too much all at once. There are, of course, exceptions to this, so don't feel like this writes you off for EMDR if you're still in an unsafe situation, but just recognize that if you're so unsafe, it might not be the right moment for EMDR, and that'd be something that you'd want to talk to a clinician about specifically to determine if it's the right time for you to do EMDR. If you have epilepsy, eye issues, like you've just had eye surgery, something like that, or you are pregnant, this doesn't exclude you from EMDR, but we need to know about it and we're gonna have conversations about that. For epilepsy, we basically just don't use that light bar that I was talking about. If you had eye surgeries, again, we're not gonna do anything with your eyes, or if you have eye conditions, we're probably not gonna do anything with your eyes, and that includes concussions. Usually what we do for those is we just do tapping instead because that's nice and safe. For pregnancy, if you're a high-risk pregnancy, we'll generally just hold off on the EMDR until after. EMDR activates your nervous system. We want it to turn on. And if you have a high-risk pregnancy, this is maybe just one factor, just one extra thing that we don't want to necessarily have to add on to that high-risk pregnancy. So we generally will just wait until after birth so that we can do that EMDR as safely as possible for you and the baby. But if you have a relatively normal pregnancy, then EMDR is totally fine. So there you have it. That is in the best way I possibly can without making it hella complicated, my explanation of EMDR, who EMDR is for. I absolutely love EMDR. I use a ton in my practice, and I think it is such a transformational way for people to be able to truly process and let go of their traumas, not just in a cognitive, I think about it differently, but truly in an embodied, I feel differently about it type of way. So I strongly recommend EMDR or other bottom-up types of therapy if you're really wanting to sustainably manage your trauma. If you have any questions, feel free to shoot me a message, and I will be more than happy to answer any questions that you have about EMDR.